Good afternoon. I'm Júlia Cavalcante, and today I want to discuss the molecular differences and similarities between cystic fibrosis, or CF, and asthma. More specifically, their microRNA profiles. You see, CF and asthma are two clinically similar diseases with overlapping pulmonary symptoms such as chronic airway inflammation and bronchiectasis, but they are very different from a pathogenic standpoint. One is a genetic disease, and the other is a highly heterogeneous inflammatory disease, both with different types of inflammation and different reasons for their inflammation. Because they still rely greatly on clinical diagnosis, they are frequently mistaken for each other. Differences on a molecular level, such as gene expression on epigenetics, though, may be able to both reduce misdiagnosis and explain the pathogenic differences and underlying mechanisms of each disease. So based on that, I decided to use the microRNA. These are small, single-stranded, stable RNA that present differential expression on many diseases, acting on post-transcriptional regulation of many genes. I checked if their expression profile could help us differentiate the diseases. After all the data and text mining, I found 47 microRNA dysregulated in CF versus 50 in asthma. 12 of them were overlapped, but after 6 of them were excluded due to lack of information and incomparable sampling and conflicting information, only 6 of them were left for comparison. From the 6, 3 of them had opposing regulations and 3 had similar regulations. The first group would be rather useful for differential diagnosis, whereas the second would be helpful for understanding the similarities in underlying molecular mechanisms for each disease, especially taking into consideration 2 of these microRNAs, 145 and 223, which target CFTR. There are still many analyses necessary to really understand the role each microRNA plays in each disease, but I think we are heading in the right direction. Thank you very much for your attention, and now for your questions.